Yes, I guess part of it is because inevitably countries have taken a somewhat selfish response to this and brought in their own controls, dealt with their own vaccinations and ordering supplies of vaccines, used different approaches to lockdowns and restrictions. And in one way, that's a very selfish, it's understandable, but it's a very selfish response. And what we keep coming back to all the time is that none of us are going to be safe from this pandemic until we're all safe. We're all in this together, and we've all got to work together. It's just a very difficult thing, shutting down the entire world. And I guess what this is telling us is that we've been rather complacent about this type of thing. That for many countries, particularly those countries, dare I say, in the West, we felt that if there are going to be new viruses emerging, they're not going to affect us. It's SARS in China, it's Ebola in Africa. We are all okay. And I think that's been a very salutary lesson, that actually we're not all okay, and that we need to think very carefully in the future about how we do develop new approaches to managing outbreaks, how we prevent them in the first place, and work together as an international community. I guess the one good thing that has come out of it is that the science has been international, truly international, and that we're all working together. But we do need a lot more joined up thinking internationally, and we need a lot of support, particularly for countries who are struggling with vaccine access. The vaccine is not 100%. No vaccine is ever going to be 100%, and that inevitably there are going to be different levels of protection dependent on your own circumstances. So we know, for instance, that the very few breakthrough infections that we're seeing are a consequence both of the more infectious and transmissible Delta variant, but also the fact that if you're elderly, if you have other illnesses, other long-term health conditions, then your body's immune system doesn't give you the strongest possible response to the vaccine. And after a period of time, your protective immunity reduces, it wanes. And so those people are slightly more susceptible, hence this idea of jabbing, giving people a booster jab over the autumn, particularly the elderly and most vulnerable. But again, that's the privilege, if you like, that Western countries have. And there's a big ethical dilemma about whether we should be providing individuals with booster shots when so many countries in the world have people who don't even have the opportunity to have their first jab. So again, it's a real issue for the global community.
Right.
I think we need to make sure that those countries are able to help with the vaccine program in countries that are poor, have low supplies of vaccine, and perhaps don't have the infrastructure to deliver those jabs into the arms of their people. We need to be really supporting those individuals. The biggest single problem we have now is, I think, some complacency that's creeping in.
Yeah.
Concerns that, we're having this in the UK now, where having lifted all restrictions, we're heading into what I think will be a very difficult time. And what that does, sadly, is provide the perfect breeding ground for new variants to occur. That's the problem. We've got to stamp out the spread of the infection. And it's a combination of a vaccine, not 100%, but also of some restrictions, including wearing face masks where necessary, and using that type of approach across the world, because what we don't want to end up with is a virus variant that is resistant to the vaccine. That would be the biggest single problem. And so it's in everybody's interest that we stamp out the spread of the virus as much as possible.